Aloha and welcome to Better Government. I'm Representative Gene Ward and I have the honor of hosting a slightly different topic from our usual legislative immediate things going on in the state legislature. We're going to talk about a national issue, universal health care. That is an issue that's on many of your minds, and I know we've been not having too many town hall meetings. This is not a town hall meeting, but I have two exemplary guests who are going to discuss universal health care. What's in the bill, what's good and bad about the bill, and maybe what you can do about it, or at least can understand a little bit better of what's going on in universal health care. I have the honor of introducing immediately to my left, Coral Andrews. Coral is the Vice President of the Healthcare Association of Hawaii. Her responsibilities include long-term care, home care, hospice, representation, that means you hang around here and lobby a little bit,
yeah.
and advocacy.
Yeah.
The Hawaii Healthcare Association, in case you didn't know what that was, is the representative group for all the acute hospitals, 2/3 of the long-term care beds, home care agencies, hospices, as well as community-based providers. One unique thing about Coral is that she has not only a nursing degree, but an MBA degree, and we want to find out how that mixture got together. We also are having a distinguished member of the University of Hawaii faculty. To Coral's left is Dr. J. Maddock. Dr. Maddock is the director and professor. Congratulations, I understand you were just promoted.
Yes, thank you.
In the Office of Public Health Studies at the University of Hawaii, Manoa, and you are the vice chair on the Board of Health, a recent appointee from Governor Lingle.
Yes.
And I understand your Ph.D. is in experimental psychology, University of Rhode Island, and an M.A. in experimental psychology, University of Rhode Island, and today maybe experimental psychology and a healthcare bill with the people of Hawaii, because quite frankly, when I was going to say what's in the bill, if I could give just a brief overview, and by the way, for those of you viewing, this is the bill. We couldn't get it into one binder because it's too big. It's 1,017 pages. It has 3 divisions, and within each division, it has in the total divisions, there's 19 titles. And let me first start with a confession. As a member of the legislature, we are known to look at bills, and the bigger they are, the less, 1, they're going to be understood, and 2, they're going to be read. A bill that's 1,117 gets beyond comprehension, and especially if they're saying, get it now and get it passed quickly. Mm-hmm. So let's take a step back and say, what's in this that we should know? What are some of the basic things? Dr. Maddock, you want to kick off with some of the things that you see that's in the bill here that are good, bad, or otherwise, or just kind of do a review of the way you see it?
Sure. You know, there's a lot of things we need to look at in healthcare reform, and one of the major things is universal coverage, and this is making sure that every American has access to health insurance, and that's one, and there's many different ways to go about coverage. So that's one of the main functions. Another of the main issues is looking at who pays for coverage. Typically in the U.S. we've had a mixture of private and public insurance, with public insurance being your Medicaid, Medicare, the VA system, and then groups that we're very familiar with like HMSA, Blue Cross Blue Shield here in Hawaii. And so there's questions about, do we create a government payer system that would then compete with the private, that it's available to all Americans, and so that is also in this bill in its current form, though the Obama administration has been wavering on the public option over the last couple of days.
Well, you mentioned universal coverage versus universal access. Aren't there two quite separate things?
Well, there's very different between universal coverage and who's paying for it. I think those are the major differences. And so one thing that is an example is the Massachusetts plan. Currently, Massachusetts, in the last couple of years, passed universal coverage. And what that means is everyone by law in Massachusetts is required to have health insurance. And currently about 98% of their population does. It's actually part of filing their state taxes. And they have an option where the state actually subsidizes low-income people to purchase private insurance. So they do not have a new public option, they actually use a private option, but they pay. And why that's important is that right now, with private insurance, people can be denied insurance for pre-existing conditions. And so a lot of people that maybe lose their job or switch jobs and get new health care can be denied coverage. and can end up with very large bills. And then the people that don't have health insurance tend to go to emergency rooms. They encourage the coverage, or the cost of emergency room care is tremendously more expensive if you're going when you get really ill, rather than doing preventive health care. And so by covering everybody, we can actually control a lot of the costs that we see in health care.
Before I ask Coral what she sees in the 1,017 pages, did you, Professor, have a chance to read all this?
No. I have
Thank you for being honest.
many summary reports, but 1,000 pages is a lot.
I started reading some of it. I said, no, why is that in there? They really threw everything in the kitchen sink. Some of the stuff I would have cut up into pieces and bits that were more digestible and understandable, but they threw everything into it, which that's a different motivation, a different discussion.
It's actually a bit of my concern about the bill.
So you've read it all?
I would like to say I have, but I haven't.
I got two honest people today here. What do you see in the bill?
Well, what I'd like to do is give the consumers and listeners just sort of an overview of how we get the information that we utilize with respect to the bills. So the Healthcare Association of Hawaii, as you mentioned, is a trade association, and we are aligned with national organizations which represent the same constituent groups that we ourselves represent. So they are the American Hospital Association, the American Healthcare Association, which is long-term care, and the National Association of Home Care and Hospice. And so they assist us in being able to digest that information by providing us at least concise summaries, so that we then at the state level, along with our colleagues from other states, can provide inputs about how these recommendations or inclusions within the bill would actually impact Hawaii. In preparing for today, I think one of the important things that everyone needs to understand is there are actually 5 versions of this bill being looked at.
Did everybody hear that? There's 5 different. Are they as big as these? They're usually
some
are longer,
I
some are
haven't
shorter.
seen them actually as nicely displayed as this.
I wanted to get them in one stack.
Now I know why I've been so busy. But if I may, just for clarification.
Please. And I like what you said, this is for the consumers to understand, because if we can't get it down at the street level where people understand it, and that's one of the problems with it. If we're going to affect the American people with an American policy, they got to understand it. Otherwise, I don't care what if it's Democrat or Republican. People want to understand if there's a major overhaul and put it in language that I understand.
Right.
And this is not doing that. And thank you for saying that you're going to do it for the consumers. So.